as you can see here, she is screaming in pain. Screaming at the top of her lungs in pain. This here is LaCrista Vaughn. She is an RN. The Dallas Regional Medical Hospital in Mesquite, Texas is where this happened. I am going to drop the mother's @ right here so you can go watch the other videos, but here's a little backstory. She was originally scheduled to be induced that day, but they called and said they didn't have any beds available. So she went home and they said that they would call her. They never did, so she kept calling and they kept saying no. Mom called the hospital and let them know, hey, she's in active labor. We are on our way right now. This is bad. They pull up to the hospital, ready to go in, but she waits in the car. She goes and she sees nurses coming with their gloves and she thinks, oh, okay, they're ready for us. They're here. Instead, she's greeted with, you can't be here. This is ambulances only. The mother explains, we called ahead. She is in active labor. She's clearly screaming in the back seat. And they're like, well, you can't park here. So the mother runs into triage and she's like, hey, do you guys have any wheelchairs? We really need one. And the lady said, yeah, there's some over there. Well, there wasn't. So she lets them know, hey, there's no wheelchairs. We really need one. She is in active labor. So they go back, they get a wheelchair, and they bring it to her. And she's like, aren't you going to come help me? And they're like, no. A police officer is there at the time, so he comes and he helps the mom. He is helping get the woman in there, and as they get outside, they realize she's on all fours screaming in the car. That's how bad it is and how urgent the situation is. When they get inside, they are so nonchalant, treating her like it's no big deal, and have her waiting in the waiting room, screaming the way she is. When she finally gets in for triage, as you can see, the LaCrista RN, she is just cannot be bothered, and she literally says, I can't do anything about this. There might be more of an excuse if she wasn't a registered nurse, if she was just, a patient care advocate or something like that. But no, she's a registered nurse. She is trained for these things, and she took an oath to help these patients. This patient is screaming, it's in my butt. Do you know what that means? If you've ever had a baby, you know what that means. The head is coming out. She's ready to go. Anyways, 12 minutes later, this woman gives birth. But not only does she give birth, but her baby has a bowel movement in the birth canal because of the stress and trauma that she endured during labor. This can also happen when a baby is in the birth canal for too long. And when a baby has a bowel movement in the birth canal coming out and it gets in their eyes and mouth, this can cause serious, serious problems for baby and mom. We need to advocate for Black women and women of minority, even if we are white. We cannot allow this to be normal. Medical negligence is not okay, and Black mothers already take the brunt of the most maternal fatalities, injuries, things associated with birth. I just really don't know how this hospital is not facing more backlash than they are, and this RN needs some kind of reprimand.